Example: consumer refused lunch instead of consumer was difficult. Falsifying documentation can lead to termination and legal action. Recognizing and reporting abuse or neglect. Types of abuse: physical, emotional, sexual, financial, and neglect. Warning signs: bruises, sudden fear, poor hygiene, or unexplained injuries. As mandated reporters, caregivers must report suspected abuse immediately. Report first to supervisor and then to Adult Protective Services if directed. Failure to report abuse can result in legal penalties. Dealing with difficult behaviors. Consumers may act out due to dementia, frustration, or illness. Stay calm, never raise your voice, and avoid confrontation. Use redirection techniques to shift focus onto another activity. Respect personal space and safety during difficult moments. Document behavior changes and notify supervisor promptly. Bathing, shaving, grooming, and dressing. Assist with personal hygiene while maintaining privacy and dignity. Encourage independence. Let consumers do what they can on their own. Prevent falls by using non-slip mats and checking water temperature. Be gentle while shaving and grooming to avoid cuts. Proper grooming boosts confidence and comfort. Hair, skin, and mouth care. Regular hair washing and brushing improve hygiene and self-esteem. Daily oral care prevents infections and promotes health. Apply moisturizer to prevent skin dryness or breakdown. Check skin for redness, sores, or rashes daily. Report unusual changes to your supervisor. Assistance with ambulation and transferring. Support consumers when walking to prevent falls. Use gait belts, canes, or walkers safely as directed. Assist with transfers, bed to chair to toilet, etc. Always keep pathways clear and encourage sturdy footwear. Never attempt to transfer alone if the consumer requires two-person assistance. Meal preparation and feeding. Prepare balanced meals according to dietary needs, low sodium, diabetic. Ensure food is cooked and stored safely to prevent illness. Encourage independence. Assist only as much as necessary. Feed consumers with dignity if they cannot feed themselves. Monitor hydration levels. Offer fluids frequently. Toileting. Promote dignity and privacy. Always knock before entering bathroom. Close doors, curtains to maintain privacy. Speak respectfully and offer reassurance. Proper safety practices. Use gloves and wash hands before and after assistance. Provide stable support, grab bars, commodes, or raised toilet seats. Ensure the floor is dry and clutter-free to prevent falls. Caregiver responsibilities. Assist with commodes, bedpans, urinals, or toilet transfers. Offer assistance with clothing and hygiene, wiping, cleaning. Encourage independence when possible. Observation and reporting. Document frequency and any unusual findings: blood, constipation, diarrhea, incontinence.